Thank you, my classmate, Dr. Shanmugam, Dr. Parandaman, and all my good friends and brothers and sisters. I have no disclosure. Of course, my speech is sponsored by Vijayakumar. So that's the only disclosure. Because 4 days back, he called me. Actually, last 10 days back, he called me. I said I won't be able to come. Only 4 days back, I confirmed that I'm coming. I never knew that he'll give this topic. And then I asked him, there's nobody who wants to take this topic, so you take. So I said, okay. Because, whenever you take a new topic, you learn. And I did not disturb Anjana this time, because every time when I get a new topic, I used to call Anjana. But this time I myself thought, okay, we'll do it. Okay. Now, the agenda of my talk is going to be, what is chronobiology? What is the body's internal clock? Circadian disruption and pathogens of diabetes? And how do you realign this disturbance? Then 3 things like chrononutrition, chronotherapy, and chronoexercise. Mind and body medicine, sleep, and future frontier and take-home message. You see, chronobiology, I'll start with like this. My friend Shanmugam took a nice breakfast in the morning. We checked his blood sugar. Blood sugar was normal. But the same food what he takes today in the morning, if he takes in the night, definitely there will be spikes. What is the reason? Is it due to diet? Is it due to drugs? Or is it due to discipline? It is time. So time is the cause for the discrepancy. So ladies and gentlemen, my talk is going to be about the time only, but only thing the chairperson should give 1 or 2 minutes extra also, the time also. Okay. Because Morgan spoke 20 minutes, I was given only 15 minutes, I don't know why. But it doesn't matter, Vijayakumar, he's not senior, he's only 1 year junior to me. Okay, fine, it's okay. So chronobiology is the study of biological rhythm and how physiological processes are regulated over time in synchronization with environmental cues such as light and darkness. See, the body follows an internal clock that is called circadian rhythm. It is regulated by central and peripheral clocks. The chronobiology bridges molecular biology, physiology, and clinical medicine to reveal how timing shapes health outcomes. The concept of chronobiology introduces a temporal dimension. I'm glad Anjana is going to talk about intermittent fasting, where she is going to talk about autophagy. That is the temporal dimension to the diabetes. When interventions, in addition to what intervention? We always talk about what intervention. Now you have to talk about when intervention. See, all my previous speakers, Tiwari, Manohar, everybody talked about food. See, we talk about what food, how much food, all that we say. But you must ask what time you have taken. So ladies and gentlemen, this is the first message to all of you. Ask them what time you sleep, what time you take medicine, what time you go to bed. All that time is important. That is the main thing. It is the only thing in biology. Actually, timing is not everything, but it is the only thing in biology. And diabetes is not just a metabolic disease. See, Morgan was saying diabetes is not a metabolic disease. He gave all 7, 8 things. But I am simple. See, Morgan is a complicated person because he knows so many things and he does so many researches. I don't do research. I am only a simple man. It is a disorder of biological timing. Somebody comes and asks you, what is diabetes? It is a disorder of biological timing. Finish. Everything comes in that. The key physiological backbone is the circadian rhythm, driven by hormones like cortisol, melatonin, insulin sensitivity, and hepatic glucose output. These rhythms influence nearly every physiological process, from sleep-wake cycle to hormone secretion and metabolism. The core idea is circadian health optimization. Optimization, the word comes because the topic is optimization. So it is optimization involving the daily activities with internal biological clock to improve metabolic health. This strategy of optimizing diabetic management rests on 3 pillars. What are those? Chrononutrition, chronotherapy, and chronoexercise. I was very happy because Morgan was talking about precision medicine. I thought he'll talk about precision medicine regarding the physiotherapy and exercise. He mentioned last slide, fitness, but did not explain. I'm very happy he did not explain because I can explain now. So chrono exercise is also one thing which is very important in the precision medicine. The rhythm of metabolism, of course, all of you know, I don't want to bore you with this. There will be peak insulin sensitivity in the morning, evening there will be less sensitivity, afternoon moderate, and night it is a metabolic rest, fasting state. Cortisol, morning peak, increased glucose. You always call as a dawn phenomena. And then melatonin, night rise, decrease insulin secretion. Growth hormone, night surge. Catecholamines, whenever you have stress. The master clock is in the hypothalamus. It is in this suprachiasmatic nucleus. It receives light cues from the eyes to synchronize internal clocks with the external environment. The disruption of the SCN signaling is implicated in metabolic syndrome, obesity, and type 2 diabetes. Then there are peripheral clocks. What are the peripheral clocks? Very important. Liver, glucose production timing is important. Pancreas, insulin secretion rhythm, and muscle, glucose uptake cycles, adipose tissue, lipid metabolism timing. All these clocks are connected with the head clock in the hypothalamus. Every cell has a clock. Every human body, a human body with interconnected clocks in various organs, illustrating the distributed nature of the circadian timekeeping across all biological systems. The key message is the orchestration of peripheral clocks by the SCN ensures metabolic harmony. If there is a disruption, that is a metabolic chaos. And this is also influenced by external factors like feeding times. When clocks go haywire, what happens? Diabetes comes. How does diabetes come? Clock gene dysfunction, autophagy failure, because autophagy failure is a very important molecule, game change process, mitochondrial damage, hormonal imbalance, and then organ dyschrony and microbiome disruption. I always very fond of microbiome. Anjana knows about that. The previous speakers talked about micronutrient, but nobody mentioned about microbiome also in the diet. Please make a point. Apart from micronutrient, microbiome like probiotic and prebiotic is also in the balanced diet. I think, Aravind, when you say balance, you must add this also in the balanced diet. So next time when you debate, do that microbiome also. Now, in a shift worker, see what happens, especially in Tirupur, most of the people work in the night and they don't have the proper food, proper rest and proper alignment. So that is why the shift workers have got more, 40% of them are having more prone to get type 2 diabetes, and the more they do shift work more, the diabetes also more. So that is why this is the link between the circadian disruption and diabetic pathogenesis. Impaired insulin secretion, increased insulin resistance, and goes to altered glucose metabolism. And these are the genes. I cannot dare to talk about genes in front of Mohan and Anjana because they are the experts. But of course, there are clock genes like BMLA1 clock, PRI, and SCRI. These genes only regulate the expression. And Mohan was talking about the genomics, which I will talk to the last slide. So genomics also play a very good, important role in chronobiology. And then, how do you optimize the strategy? They optimize the strategy of this disruption by chrononutrition, light hygiene, and then exercise timing, eating windows, chronotherapy, and sleep hygiene. That's how we can optimize any disruption. The chrononutrition, eating in synchronize with your body, the principle of timing, nutrient intake to optimize metabolic rhythm. It is not what you eat, but when you eat. That is most important. And then chrononutrition can improve HbA1c, fasting glucose, insulin sensitivity without changing the total caloric intake. And then timing is everything. I told you, prioritize meals earlier in the day. The important another message is you always take the meal early, and also in the evening also before 7 p.m. or 6 p.m. you finish the last dinner. And then fasting periods, of course intermittent fasting is also very good. And macronutrient distribution, I think the previous speaker was speaking, were giving elaborate on this. This is the power of the eating window. This is very important. What is power of eating window? Research suggests that restricting the time window for food consumption can improve insulin sensitivity and glycemic control. Example, a 10-hour eating window from 8 a.m. to 6 p.m., which means you eat only between 8 a.m. to 6 p.m. Don't take anything after 6 p.m. You will be 100% all right. You know, recently, because the other speakers was talking about Turandar. Myself and Morgan was wondering what this Turandar is, because we didn't see the movie. So next time when you quote in the film, don't put Turandar, some common movie which we know also. So that's better. Okay. So I again, doesn't matter. I quote one of the recent, actor was saying, I'm hale and healthy because I don't eat anything after 6, heroine, not a hero. Heroine said, after 6 p.m. she won't eat anything. That is why she looks very charm and good and no disease. So that is a message, again, I want to give it to you. Eating window should be 8 a.m. to 6 p.m. Don't take anything after 6 p.m. You'll be all right. Then irregular eating, late night eating. Don't eat, post-branded, especially the organizer, Vijayakumar, is very good. 5 o'clock he concludes the meeting and he says you can have dinner from 6 p.m. to any time. So that's a good thing, Vijayakumar. You don't give dinner like other people after 9 p.m. So late night eating is also avoided. And breakfast, you should eat like a king breakfast. You should be a king-like person to eat breakfast. And then lunch, like in me. For dinner, like poor beggar. That means quantity, quality, everything will be good. And then you must take food in this order. First vegetables, then protein, then carbohydrate. So advise patients to start every meal with salad, non-starchy vegetables before consuming carbohydrate-rich foods. So next time when you organize conference, Anjana, make sure everybody takes only vegetables and if possible some carbohydrate. Then the message will be very clear. Then chrononutrition practice. See, we compared mice and the men. The mice fed during night time, they develop obesity, diabetes, etc. Compared to the person, compared to the fed during the active phase. Same way in the human also, there are a lot of studies are going on. So during rest, especially, you should not give too much of food. The chrono exercise, I was saying about timing of the activity. The effect of exercise can differ significantly based on time of the day. A 2024 study found that morning exercise combined with pre-breakfast metformin was more effective at lowering blood glucose than taking medication after breakfast. So chrono exercise, again, it's a personalized medicine. Each person differs in the exercise. For example, what Aravind from Jaipur, when he walks for half an hour, his heart rate comes down and his weight comes down. Whereas if I do the same half an hour, I may not have the same effect. So it varies. Again, precision medicine comes, precision exercise. So exercise also you have to prescribe according to the individual, according to genomics, according to his culture, everything. So exercise timing, of course, morning is better. Sometimes afternoon also okay. Evening, better avoid because it may affect your sleep. Then chronotherapy, of course, glucose varies across 24 hours. The core concept, align therapy with circadian rhythm. Morning therapy, you always give metformin, SGLT to suppress gluconeogenesis and manages early hyperglycemia. Pre-meal therapy, especially post-prandial hyperglycemia, you give alpha-glycosidase inhibitors, acorbose, and then rationalis reduces post-meal glucose excursion. Evening therapy, of course, evening because of the insulin resistance, you can give GLP-1 and then DPP-4. Night, please avoid sulfonylureas because it can produce hypoglycemia. Then coming to mind, how many minutes more? Sorry. Mind and body medicine. I thought you will give 2 minutes. Thank you so much. Mind and body medicine. That's why whenever you want to have a chairperson, you must have a chairperson like Shanmugam, not like Narsingan. Narsingan will be very strict. Even before that, he'll say. So good that Shanmugam is there. Gut-brain clock axis, light therapy, sleep medicine, stress management. You see, a word about light exposure. Everybody, even if you get up at 7 o'clock or 8 o'clock, doesn't matter. Have 30 minutes or at least 20 minutes of light. That creates a good environment and minimize exposure to bright blue light, especially night time. Don't look into WhatsApp, don't look into television, and you should have good light also. Lighting also is good, important. And daylight exposure is very important. Prescribe light hygiene as a part of diabetic management. So tomorrow, I think Mohan will start light therapy in the hospital also. He will create an artificial light also, which will look like sunlight. That is also therapy. So light hygiene is a part of diabetic management. Morning sunlight and evening screen reduction are free effective intervention. Then gut-brain clock axis. This is again gut microbiota. I think everybody knows about gut microbiome. That also has got a rhythm, and any alteration can produce bile acid impact and insulin signaling. And then stress management, of course, chronic stress, elevated cortisol, and then disruptive of circadian rhythm. And mindfulness, you see, mindful eating is very important. See, none of us do mindful eating. When we eat breakfast, we don't know what we are eating. Just routinely, we eat. Especially when we eat breakfast, we think about the hospital. And we go to the hospital, we think about the neighbor. So we don't, really do anything mindfully. So I think you will have a mindful eating, and that will also gives you awareness about hunger cues. Then sleep. Sleep is very important. I'm glad somebody is going to talk on sleep and diabetes. And the sleep duration should be 6 to 7 hours per day. The Sadhguru, all of you know, that last week he said, don't sleep for 6 hours, you will become lazy. So I'm going to argue with him. I must have a one-to-one chat with the Sadhguru. He said, don't sleep more than 6 hours. But all the science says 6 to 7 hours. And then sleep also, the brain clears metabolic waste and consolidation memory during sleep, supporting behavioral regulation of eating habits. And then harmony of mind and body and time. I told you, time, respecting biological time, transfers ordinary lifestyle into powerful metabolic medicine. And then chronogenomics. This is what Mohan was saying, GLC. The GLC has come in a long way, especially it came in as a cancer. Now for everything is GLC. See, there is going to be a machine, which I think soon it will come. It will tell you when will you get a heart attack, when will you get hypertension, when will you get cancer, and what type of medicine you have to take. All that is there. And somebody asked me whether you will undergo with this. I said, no, I don't want to know when I'm going to die. When I want to have a heart attack, I'll be very happy. So somebody, bringing this machine. And for cancer, I'm trying to bring it to Tirupur Hospital. It's 19 crores. Just a genomic study which we can do. Of course, microbiota modulation is also there. And then now, only one thing. In the 2025, we thought it is diabetes is a metabolic disease. Now evidence compels to redefine diabetics as a disease of circadian network failure. Previously we thought it is due to circadian rhythm disturbance. So no more rhythm disturbance, it is a whole network failure. Not only one, all the cells, disharmony. So that is why recently 2025 they defined diabetes as a circadian network failure. So that is why you may have good sleep, but still you have diabetes, because other organs are not good. So the network failure is the main cause, and now break down the biological timing across multiple organs can produce diabetes. This is another thing, glucokinase timing. The glucose sensor, glucokinase is under circadian control. Misaligned timing, impaired glucose screening, and you get exaggerated meal spikes. A new therapeutic idea for diabetes is time-targeted glucokinase activation. This glucokinase is like a goalkeeper. It produces glucose sense. So I think that is the recent finding. And then I already told you about diabetic management, light management. For the shift workers, creating a consistent light exposure, eating schedules can help mitigate metabolic risks associated with irregular routine. Now finally, take home message. Time is not just dimension of physics, it is dimension of medicine. Respecting biological timing is the next frontier in diabetic care. Diabetes is a disease of time. Timing matters as much as treatment. Timing of meals matters. Timing of medication matters. We don't need more drugs. We need drugs to be given on time. We need better timing, focus on sleep, stress, and meal timing, combine pharmacotherapy and lifestyle, personalized treatment. Precision medicine comes here, then only it's good. So you have a proper timing for everything, your diabetes under control. So ladies and gentlemen, my drive home message is here afterwards, please, stick to timing. Whatever time you take breakfast, early better, stick to it. And night before 7, you have the diet. And whenever your patient comes, you ask everything. Also ask what time you sleep, what time you take food, and time. This is the biological timing. So ladies and gentlemen, thank you, Vijayakumar, for giving me a good opportunity to talk about this.